Now, it was definitely a difficult case, but most of the viewers were good enough to pick the important signs like hazy cornea and staphyloma anterior, or you can say ciliary or intercalary staphyloma in the left eye. Now, parents brought this kid to me with the history that the patient was born without eyes. I got surprised when I inquired. They elaborated that there was no black area, but gradually this black area started to appear, and now the patient has eyes, and we think that he can have vision as well. Now, that gave me a hint that most probably it is a case of a sclerocornea, because maybe now the cornea has a bit grown, and sclerocornea is a non-progressive disease. But still, whenever you get a history of a cloudy cornea at birth, you should rule out all the causes of cloudy cornea at birth. And there is a mnemonic like stumped, S for the sclerocornea, T for the trauma, birth trauma, U for the ulcers, keratitis, M for the mucopolysaccharidosis, P for the Peters anomaly, E for the endothelial dystrophy like CHED, as well as CH congenital hereditary stromal dystrophy and posterior polymorphous dystrophy. D for the dermoid, also include congenital glaucoma as well. So this patient needs EUA. Usually when severe corneal opacification like this patient comes, vision is markedly reduced. EUA is advised to evaluate the intraocular structures, and then we will decide whether any intervention like keratoplasty is required or not, and is beneficial for this patient or not. Now, dystrophies have a distinct limbus and they are progressive. They have hazy cornea with bluish tinge. In congenital glaucoma, there is ophthalmos, large corneal diameter, watering, redness, photophobia. So these are ruled out. Mucopolysaccharidosis is the most near differential, but it is also progressive and can have other systemic features as well. It could be. In Peters anomaly, the periphery is clear and center is involved. So it's not Peter as well. Sclerocornea is the most near one. Now, sclerocornea is a congenital disorder in which cornea is opaque and resembles sclera. It is a non-progressive, non-inflammatory congenital anomaly, usually an isolated entity involving both eyes, as in this case. It can be mild, moderate, severe. Now, histopathology reveals disorganized collagenous tissues containing fibrils that is larger than normal. Microphthalmia can also accompany. Limb deformities, craniofacial and genitive urinary defects can also accompany this finding. Usually when severe, like in this patient, vision is markedly reduced. So we will perform EUA and we will try to identify the etiology of cloudy cornea in this case, but most probably it is a sclerocornea, severe form of sclerocornea, and the nearest differential is mucopolysaccharidosis. I hope now remember the causes of cloudy cornea at birth. The mnemonic is stamped with congenital glaucoma. Thank you very much.